is Martha Wilkinson. I live in Champaign, Illinois, and I'm wearing my pink hat today because I'm a survivor of breast cancer. Now, my own particular healthcare story kind of started in 1996 when I had to have surgery to have my gallbladder removed. After insurance, I had about a $10,000 medical bill. And then over the years, I've had 2 surgeries for endometriosis. And then at the age of 35, I was diagnosed with breast cancer. I'm now 41. I'm unemployed. I'm in the middle of bankruptcy. But I'm also working on my master's degree, so it's not like I'm just sitting around doing nothing to better myself. I'm applying for jobs and have been. Doesn't really seem to be much of anything out there. But I will tell you one thing, that private insurance for me has dictated where I could go get medical care, who could treat me, the quality of treatment that I received. My first surgery for endometriosis, the doctor could diagnose me, but he could not treat me. So I had to change insurance providers so I could find a doctor who could treat me. When I was diagnosed with breast cancer, I could get my chemotherapy at Christie Clinic, I could get my radiation at Provena, but in order for me to get reconstructive surgery, I had to go to Springfield. Because the doctors here were not in my network. Since I've lost my job, and this was before Obama became president, the amount of money that for me to continue COBRA coverage would have eaten up every single dime of unemployment. I'm a single mother. I cannot afford that. I have a daughter who's 17. For a while we were on Medicaid. But then I was making too much money drawing unemployment to get Medicaid. And then due to a little billing dispute, my daughter lost her medical. I just reapplied for Medicaid. My unemployment has just run out. I got a little letter from Springfield saying I did not provide sufficient information about my income to provide temporary coverage for my daughter, who is 17. That is shameful. And I provided my unemployment stubs. I also provided the order of support that I get from my daughter's father. But that was not sufficient information for my income. Then I got a letter from the local office saying I did not provide sufficient information proving that myself and my daughter are American citizens. Let's see, when I applied for Medicaid this time around, I submitted copies of my certified birth certificate, which is Wabash County, Illinois. My daughter's certified birth certificate, she was born at Carl Clinic in Urbana, as well as my driver's license and her state ID. But that is not sufficient information proving that we're American citizens. So I resubmitted all that information along with a copy of my Social Security card and her Social Security card. I'm still waiting. You know, I am of the opinion that health care is not a privilege. It doesn't matter whether you're working full-time, part-time, or not working at all. Healthcare to me is a basic human right. If I pick up the phone and I call 911, my government subsidized fire department will be there. My government subsidized police department will be there. But why is it that I have to fight and argue and submit paperwork and submit paperwork and submit paperwork just to get basic medical care? And even with Medicaid, the only reason why Christie will take me is because I was already a patient with private insurance. If I just moved to the state of Illinois and I got Medicaid or my daughter got Medicaid, we would not be able to get care at Carl or at Christie. You know, so me, no, I'm not going to cry. Neither am I going to be really happy about this. I'm just kind of at a point where, frankly, I'm just mad. And I have the right to be mad. And if Mr. Johnson really doesn't want to pay for my medical care, that's cool. I don't want to pay for his. Yeah.